World Antimicrobial Resistance Awareness Week is a global campaign to raise awareness and boost understanding of antimicrobial resistance to promote best practices among health stakeholders. The day, celebrated yearly from 18 to 24 November, seeks to reduce the emergence and spread of drug-resistant infections. Gathered stakeholders from FAO, the Medical Research Council, Food Safety among others. The team preventing antimicrobial resistance together encourages sectors to use antimicrobials prudently, to work together and strengthen preventive measures towards addressing antimicrobial resistance. Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial agents. As a result of drug resistance, antibiotics and other antimicrobial agents become inactive and infection become difficult or impossible to treat, increasing the risk of disease spread, severe illness, and death.
WHO and partners put aside this week to create awareness to use of antimicrobial agents. The key word here is we want to encourage the optimal use of these antimicrobial agents. We mean to say that any person who intend to use the antimicrobial agents must ensure that you use it for the right cause.
In 2019, the World Health Organization estimated that 4.95 million deaths globally were attributed to drug-resistant bacterial infection, with 1.27 million directly related to antimicrobial resistance. The Gambia launched the National Plan to tackle antimicrobial resistance in 2021, with situational analysis on antimicrobial resistance conducted for the first time to benchmark information on antibiotic consumption in hospitals and local communities, tying it with resistance data gathered at laboratories.
The misuse and abuse of antimicrobial agents does not only limit to human health, it also cuts across animal health and environment. The slogan is handle with care. We want each and every person to handle these antimicrobial agents with care. It should not wrong person should not handle it. And we should not use it indiscriminately, such as giving other leftover antimicrobial agents at the house. That's a common practice that's in our society. Sometimes we tend to use antibiotics halfway along the line. When we get better, we stop using them.
Meanwhile, considering the increased risk posed by antimicrobial resistance, in 2022, the Gambia developed a National Action Plan on Antimicrobial Resistance in 2023-2027, which identifies key measures to be implemented by 2027.
AMR in particular is on the rise, where we have the misuse of medications, that is antibiotics, especially in the developing countries. So, and this, as a result, contribute to the resistance. That is where these antibiotics that are supposed to stop the growth of microbial infection or kill them are now getting resistant to these drugs. In the Gambia, we have actually been doing a lot in terms of AMR. That is how we can tackle it, both in the laboratory side and then in the awareness bit. So with the support of WHO as a country, we've set up so many things. That is, for example, the NAPS, the National Action Plan for AMR, that is at the draft stage. And then also we plan to do a lot of sensitization, and this is one of it.
Sheikh Joof, reporting for GRTS News.